Well, I was working at the City County Health Department in Helena, and my boss came by my desk. And he said, I've just been talking with a really smart man. He knows a lot of things about a lot of things. And he's looking at this little card, and he said, so if you ever have a question you don't know the answer to, you should call him. So I take the card and I look at it. It says, Dr. Strange. And on the back is a phone number.
My husband, Alan, was an extremely bright person, and he had the ability to look well into the future. He had a wit that was almost indescribable, and it was very hard to tell if he was teasing you or if he was serious. And there were people who were put off by his wit many times over the years. And then when they would really learn what Alan was like, they would love him.
Alan was one of the founders of the Community Health Center movement in our state. He was the initial executive director of the Montana Primary Care Association. And really, in the early days of health centers, Alan wrote a lot of the grants and made a lot of the projects come to life.
So we honor him because it's hard to be the first. It's hard to start a system of care. There's often people who talk about what we should be doing, but Alan was able to make it happen, and make it happen in some of the poorest communities.
I've always thought of Alan as being bilingual because he speaks English, but he also speaks Federalese. And he was always great at helping us understand what to put in a grant application that would be just the right way that the feds were looking for those words.
With Alan, he took his beliefs and he put it into practice. He did something very specific. He helped us open clinics, which were access for people to get real care by real providers. And the impact has been profound in people's individual lives, as well as in a system of care in Montana.
People would want to talk to him and sort of gather his wisdom. And he had that, that great mane of white hair and that real distinguished look. He's a big guy, and he sort of commanded a room.
He's incredibly generous, he's kind, he's funny. He loves rock and roll. He will stop and give any homeless vet $20, a $20 bill, or any homeless person with a dog, because he loves dogs too.
Alan, thank you for teaching me the importance of healthcare to rural and frontier communities, and to always advocate for sustainable healthcare systems. And remember, always leave a big tip. We have a reputation to keep.
Your sense of humor always made the ride fun and interesting, and I think we accomplished some wonderful things together.
Personally, I'd like to thank Alan for the opportunity to get to know the beauty of the landscape and the people of the state of Montana, even though that involves some pretty scary winter road trips across North Dakota and eastern Montana.
Because we were in so many meetings together, I got to know him in the meeting and out of the meeting room. In the meeting room, he would only speak if he really had something that would move a conversation forward. And at the end of the meeting, he knew how to have a good time.
Some people thought we were fishing, or hunting, or enjoying the shooting sports. Little did they know that we were also looking for places that needed health centers.
I would like to extend my sincere gratitude to Alan for his manifold contributions to Montana, Region 8, and the health center movement nationally.
Alan was also incredible testifying on Capitol Hill. He put a face on the needs of the people and the situations that existed and what it was that people needed.
Sometimes the job would get a little heavy and lots of obstacles, lots of work to do, and he was always supportive, always had a fun sense of humor, and was calm and reassuring to me.
Thank you, Alan, for so generously sharing your knowledge, wisdom, insights, and most of all your humor with me over these 25 years. You're the best.
With Alan, I think we saw one person do something profound and have a profound impact widespread in the state. I think that's a challenge to us, to remind us of what we can do and what we do every day, and the big difference we can make by doing something small every day.
It isn't easy to make a difference. It takes a real commitment. It takes continuing to work no matter what and never, never turning back. And that's what I want people to learn from Alan's story.